The gallbladder is a pear-shaped sac organ with a muscular wall that is about 5 inches long. It's located in the right upper side of the abdomen, just underneath the liver. It is connected to the liver and intestines through small tubes called bile ducts. The primary purpose of the gallbladder is to store and concentrate bile. This is a greenish-brown fluid that is produced by the liver. Bile carries waste products out of the liver, but it is also needed to digest and absorb fatty foods and to absorb important fat-soluble vitamins. If the gallbladder is removed, the liver will just make the bile on demand when you eat fatty foods, instead of storing it in the gallbladder. Gallstones are solid pebble-like concentrations that abnormally form inside the gallbladder. Roughly 10% of Canadians have gallstones. Fortunately, most people with gallstones do not have symptoms and do not even require treatment. In some cases, however, gallstones cause pain or other complications and must be treated, usually by removing the entire gallbladder with the contained stones. Who gets gallstones? Gender. Gallstones are more common in women. Age. The risk of gallstone increases with age. Genetics. Gallstones are more common in certain families, suggesting genetics has a role in gallstone development. Some other factors that do contribute to gallstone formation include pregnancy, use of certain medications that contain estrogen, such as birth control pills, obesity, frequent fasting, rapid weight loss, including patients who have surgical weight loss treatments, lack of physical activity, and diabetes. What symptoms will we experience with gallstones? Some are silent gallstones, and the majority of people who have gallstones do not have symptoms. These stones are referred to as silent gallstones, are often found on an ultrasound or CT scan done for other reasons. Silent stones do not need to be treated, since the initial symptoms of gallstones are usually mild and do not outweigh the risks involved in removing the gallbladder. Biliary colic, on the other hand, it manifests as attacks of abdominal pain, often located in the right upper belly, just under the lower ribs. Sometimes it is felt in the center of the abdomen, or even sometimes in the lower chest region, causing it to be confused with heart attack at times. You may also feel nausea, vomiting, pain in the right shoulder or back. Biliary colic usually happens when the gallbladder that contains stones contracts in response to a fatty meal. This compresses the stone against the gallbladder, and this outlet gets blocked in its opening. And the gallbladder relaxes several hours later. After the meal, the pain subsides. And once you have a first attack of biliary colic, there's a good chance you will have more symptoms in the future. Such recurrent symptoms are usually more severe and occasionally are associated with complications. Acute cholecystitis, on the other hand, this refers to inflammation of that gallbladder. Happens when there is complete blockage of the gallbladder outlet caused by a gallstone. Usually biliary colic, which resolves within a few hours. Pain in cholecystitis is persistent and is associated with fever commonly. Acute cholecystitis is a serious condition that requires immediate medical treatment in the hospital. Treatment includes IV fluids, antibiotics, and pain medication. Surgery to remove the gallbladder along with the contained stone is recommended treatment during the same hospitalization or shortly thereafter. Choledocholithiasis, this complication can develop if one or more gallstones leave the gallbladder into the main bile duct and block the area where the bile exits into the small intestine. This may lead to jaundice, which is yellow discoloration of the skin and eyes. Acute cholangitis, this is when you get infections of the bile ducts that causes pain, chills, and fever. This is a life-threatening condition that requires prompt treatment, usually involving removal of the blocking gallstones with a non-surgical procedure known as an endoscopic retrograde cholangiopancreatography, or ERCP for short. Acute pancreatitis is another complication with gallstones, which is sudden inflammation of the pancreas, leading to severe abdominal pain in the center of the abdomen. How do we diagnose gallstones? There are two parts to diagnosing gallstones. One is determining if the gallstones are present, and two, determining if gallstones are the cause of the symptoms. Gallstones are usually found using ultrasound imaging, and which is a painless test that uses sound waves to create an image of the gallbladder and the stones. An ultrasound is the most sensitive test with which we find gallbladder stones, but gallstones can also be detected in other imaging tests such as CT. Having gallstones does not mean that the gallstones are the cause of your symptoms, however. Thus, other tests may be recommended if there's doubt about the relationship of the gallstones to your symptoms that presenting with. How do we treat gallstones? Laparoscopic cholecystectomy is the most common technique to remove the gallbladder. In this technique, small instruments and a lighted camera are inserted into the abdomen through several small incisions. The abdomen is inflated with CO2, the gallbladder is removed, and the openings are then closed with absorbable skin sutures. What are the risks of cholecystectomy? Approximately 5% have looser stools, gas, and bloating. In most people, these symptoms are mild and do not require treatment, and most of them will improve with time. 1% will have wound infection and blood clots. 0.5% or less of people have pneumonia, heart complications, UTI, or kidney injury, and less than 0.1% will have a bile duct injury.